In this section, we will train you on the proper use of the HoverMatt air transfer system in radiology. We'll show you the correct technique for transferring onto and off of an imaging table. We will also demonstrate another patient handling task, how to turn a patient using the HoverMatt. This technique can be used in any hospital department to position a patient onto his or her side. For training purposes, we will use the example of turning the patient to position for a cross-lateral X-ray. We'll also discuss the use of the HoverMatt in the MRI environment. This segment will show the use of the HoverMatt. Remember to review using the HoverMatt air transfer system and HoverTech air supply video for detailed instructions before using the HoverMatt transfer system. The HoverMatt air transfer system is radiolucent and artifact-free. If a patient is not mobile or requires a great deal of prompting to laterally transfer, he or she can be transported to radiology on a stretcher equipped with a HoverMatt air transfer system. Lower the rail of the stretcher nearest to the imaging table and ensure that the HoverMatt is not caught between the mattress and the rail in the process. Move the stretcher as close as possible to the receiving surface. If there is a very wide gap between the surfaces or their heights are very uneven, you may use HoverTech's transfer bridge or a full-length slide board to span the gap. In this case, we are able to transfer without the aid of a bridge. Lock the wheels and lower the far stretcher rail, ensuring that the caregiver on that side remains close to the patient. Attach the air supply hose into the HoverMatt hose opening closest to the receiving surface. Inform the patient of the task. Assume the position of safety and instruct the other caregiver to turn on the air supply. Transfer your patient onto the imaging table using the stay close approach. Be careful not to over-transfer, as the imaging table is a very smooth surface and the HoverMatt will easily glide onto it. With a caregiver on either side of the patient, reposition the patient on the inflated HoverMatt to ensure that his or her body is centered on the imaging table. Once the patient is in the desired position, one caregiver should assume the position of safety, explain the task to the patient, and instruct the other caregiver to turn off the air supply. Unbuckle the safety straps and position them away from the X-ray site. Perform the X-ray procedure while the patient remains on the deflated HoverMatt. After the X-rays have been taken, use the same safe patient handling technique shown previously to reinflate the HoverMatt and transfer your patient back onto the stretcher. The HoverMatt can also be used to turn a patient onto his or her side for radiologic procedures requiring this positioning. With the HoverMatt deflated and the patient centered on the X-ray table, position at least one caregiver on either side of the patient. Inform the patient of the task and assess what position they can tolerate best. If physically able, ask the patient to position his or her leg and/or arm to assist with the turn. The leg opposite the turn can be placed in one of three positions. It can be bent at the knee, or if no hip precautions exist, crossed over the other ankle. If neither position is comfortable, it can rest in a supine position beside the other leg. Once the patient has been positioned, assume the position of safety and have the other caregiver turn on the air supply to inflate the HoverMatt. The first step to the turning process requires the HoverMatt to be moved laterally away from the side to which they are turning. To do this, the caregiver on the side to which the patient will be turned uses an open-handed technique to push the HoverMatt, while the other caregiver grasps the handles to pull the HoverMatt. Stop when the side the patient will be turning onto is midline on the imaging table. The caregiver on the turning side will then place one hand on the inflated HoverMatt by the patient's upper torso, as close to the body as possible. The other hand should be raised in preparation to stop the patient's upper body from over-rotating once he or she has reached the desired side positioning. The caregiver on the turning side then initiates the turn by pressing down one hand on the HoverMatt, while instructing the caregiver opposite the turn to simultaneously pull up on the HoverMatt using the handles. As the patient rolls to one side, the caregiver receiving the turned patient will place both hands on the patient's upper and lower body to stop the turning motion and hold the patient. Assess the patient's position. If the body is not yet centered, push the patient's body back onto the inflated HoverMatt and have the opposite caregiver use the handles to pull the inflated HoverMatt back slightly. Pull backwards, not upwards, to achieve the desired positioning. Once centered, return the patient onto his or her side. The caregiver on the turning side will then hold the patient in place with the one hand on the shoulder and the other on the hip in a modified position of safety. The other caregiver will turn off the air supply and remove the safety straps, arranging them away from the imaging area. The cross-lateral X-ray can then be performed while the patient remains on his or her side on the deflated HoverMatt. To return the patient to a supine position, attach the safety straps, inform the patient of the turn, and assume the same modified position of safety, with one hand on the patient's hip and the other on the shoulder. Have the other caregiver turn on the air supply. As the caregiver behind the patient holds the inflated mattress handles, push the patient's body back against the inflated HoverMatt. The opposite caregiver will lower the HoverMatt until the caregiver that faces the patient can see the handles. The caregiver grabs the nearest handles and pulls the HoverMatt toward him or herself, while the other caregiver simultaneously pushes the HoverMatt until the patient is supine and centered on the imaging table. Return to the position of safety. Let the patient know that the HoverMatt will deflate and inform the other caregiver that it is safe to turn off the air supply. Reposition the patient's leg and/or arm if either was crossed for the turn. Use the lateral transfer techniques explained earlier to return your patient to the stretcher for transport back to the floor. Ensure the patient is centered on the stretcher before deflating the HoverMatt, and raise the stretcher rails after deflation is complete. The HoverMatt can also be used in the MRI. The snaps on the hose and transfer mattress are made of nickel-plated brass and are safe to use in the MRI environment. However, the air supply canister must be kept out of a magnetic environment. HoverTech offers an extra-long hose purchase option to operate a HoverMatt in a magnetic field. In this segment, we explained how to use the HoverMatt in the Radiology Department. We taught one HoverMatt patient handling task: turning a patient. Here are the key points from this section. The HoverMatt air transfer system can be used in radiology to make transferring and repositioning the patient easier and more efficient. Because it is radiolucent and artifact-free, the HoverMatt transfer mattress can be left beneath the patient during the X-ray. The HoverMatt transfer mattress can also be used to turn a patient onto his or her side and then back to supine. For training, we use the example of a turn needed to perform a cross-lateral X-ray. You can also use this technique anytime a patient needs to be turned. If there is a gap between the imaging table and the transfer surface greater than 8 inches, use the HoverTech transfer bridge or full-length slide board to span the gap before transferring the patient onto the imaging table. In this section, we reference the correct procedure for inflating the HoverMatt transfer mattress, taught in the Using the HoverMatt Air Transfer System and HoverTech Air Supply video. A HoverMatt transfer, using the Stay Close approach, taught in the Using the HoverMatt Air Transfer System and HoverTech Air Supply video. The proper positioning of an X-ray cassette, explained in the Using the HoverMatt Air Transfer System in the Emergency Department video.